done with your urinary altered urine production. Now we're going to continue with our altered urinary elimination. When we say altered urine production, so as we have said, it is the kidney who is at fault, or the problem is the kidney. Now in your altered urinary elimination, the problem now is the storage. As what I've said, it is the storage. So basically, it is your urinary bladder. So bakit may problema si bladder? Possibly may stones, or possibly may blockage caused by your crystals, diba? Depende sa food intake natin. O, example, kung highly salty yung food intake, tapos less water intake, so there's a tendency you will suffer from this problem with your urinary bladder. Another thing, problem for the aging. So when it comes to aging, the problem there is the urinary sphincter, yung parang garter na nag-hold ng ating opening of the bladder down to your urethra, then to your urinary meatus. Medyo, kung sa garter pa, medyo, paso na po siya, or medyo weak, or what we call this one, hindi na po siya masyadong elastic. O, diba? So, pwede na siyang, hindi na po siya capable mag-hold. So, frequency and nocturia is your problem, the problem with your altered urinary elimination. So, voiding at frequent intervals, that is often than usual. Or, sa Bisaya ni siya, it is your busaw. Okay. Busaw ni siya. The cause are the followings. With increased fluid intake, so possibly pag maraming fluid intake, marami tayong fluid intake, especially during elderlies, sa mga matatanda, so dapat less na po yung fluid intake during the night, or when they are about to sleep, or what we call this after dinner, dapat konti lang po yung tubig. Kasi pag maraming tubig na pinainom tayo sa elderly, ang tendency is they will have this frequency in urination. And the problem with elderlies, they have this tendency to be awakened easily. Kung konti lang, or problem lang with urinary bladder, nagigising sila. But they have this problem po, that they have this difficulty of sleeping after they have been awakened. So, dapat, hindi po natin siya dinidisturbo sa pagtulog ng matanda. Okay, wala po dapat disturbo. So, it includes now your frequency in urination. Again, limit the fluid intake, especially during after dinner. Okay, letter B is your cystitis. Inflammation of the bladder. So, CYS is your urinary bladder, and we have anything that ends with ITIS, meaning inflammation. So cystitis, inflamed po si bladder, so will suffer from frequency. Diba? Or yung busaw. And the other thing is stress. So stress, we have here your, what we call this one, especially if you're about to take an exam or an interview, palagi tayong naiihi because of your stress. And one thing is the pregnancy, nga naman, bakit? Kasi yung urinary bladder natin, ay, yung urinary bladder natin ay parang nakatungtong po siya sa halfway sa yung rectal area, at the other way sa yung urinary bladder. Ay, not urinary bladder pala, yung uterus natin, nakatungtong po siya sa urinary bladder, and halfway we have there your rectal area. So, due to the growing fetus inside the womb, so the expectant mother now will feel the urge to urinate. Okay, so those are the causes of your frequency. And we have necturia also. Anyways, your necturia is defined as nic means night or your nocturia. You have increased urine frequency at night that is not as a result of increased fluid intake. So that is your nocturia or nicturia. So I've said sa matatanda, sabi natin, there will be, kung sa garter pa, weakened urinary sphincter. O yung nag-hold po na urine sa bladder. So yung parang waistline doon sa bladder and then urethra, o yung tube mismo na nagko-connect sa bladder to the outside wall, your urinary meatus. Hindi na po siya mag-hold. So that is why you will suffer from nocturia. Okay. Number 2 is urgency. The feeling that the person must void. So that is also the problem. So but the first one is frequency and nocturia. The second one is your urgency. Nafe-feel niyo ba yung gusto niyo umihib ng pagdating niyo sa CR, hindi kayo makaihi, di ba? So that is now your urgency. And the third one is your dysuria. Dysuria from DYS, as what I've said, DYS prefix is painful or difficulty. So, while your urea, it signifies your urine. So, dysuria means painful or difficulty in urinating or voiding. It is caused by urinary tract infection, injury to the bladder, or urinary bladder, or the urethra itself. Again, dysuria is painful or difficulty in voiding. And the fourth one is your enuresis, or it's somewhat called as voiding in the mat, meaning it is repeated involuntary urination in children beyond the age when voluntary bladder control is normally acquired, usually 4 to 5 years old. So, enuresis means sa Bisaya na umiihi sa banig. O, yan po. Number 5 is your urinary incontinence. This is inability to control the release of urine from the bladder. So the problem here is your urinary bladder. So how would it happen? For example, as what I've said, weakened urinary sphincter, diba? So weak na po yung urinary sphincter or yung lock po o parang controller ng urinary bladder na weak na po. Kasi wear and tear theory, matanda na po yung tao, masyado na niyang gamit na niya po yung urinary bladder niya. So there's a tendency they will suffer from urinary incontinence. So that is just very much prevalent among elderlies, di ba? And not even elderlies, hindi po lahat na elderly may urinary incontinence. Pati po yung mga adult. Remember, if you're coughing or we have problems with our respiratory system, so we have this symptoms of coughing. When we cough, di ba? Every time we cough, lumalabas yung ihi din. Oh, that is your inability to control the urine. That is also brought about by the pressure we exerted to the to remove the microorganisms that gain entrance inside your lungs. So because of that pressure, it leads now to urinary incontinence. Number 6, we have functional incontinence. Persists because of physical or mental disorders or some environmental factors that prevents the client from reaching the bathroom. Okay, sometimes we have trauma, di ba? Ang tendency pag na-traumatize yung tao, let's say na-rape. Pag nakita niya yung rapist, so there's a tendency na iihin na lang siya basta-basta. Or let's say, hindi po siya makarating sa CR kasi ang problem is nahihirapan siyang mabarin yung pantalon niya, di ba? So there's your physical disability. Okay. So, or masikip po yung pantalon kahit walang diferensya sa utak or something. Pero masikip yung pantalon, hindi maalis-alis sa katawan. So, umihi na lang with it on. Diba? Or mental disorder. Okay. So, we have the person suffer from incontinence because of it is related with your problem mentally. So the person suffer from incontinence because it is related with the problem physically. For example, handicap or paralyzed, something like that, hindi po siya naiihi na lang po siya basta-basta. Or, sometimes po, a problem with your paralysis that includes also and the area concerning your urination, so you will suffer from functional incontinence. So areas of the brain that is concerned with urination, you will suffer from functional incontinence again. Number 7, urinary retention, inability to urinate or completely empty the bladder. An adult bladder is only capable of holding 500 ml to 1 liter of urine at one time. But in retention, bladder tends to hold 3,000 ml of urine. In this case, the person is too so much focused with something. Just like, for example, during labor, diba? Labor, yung panganganak. Usually, the women or the expectant mother suffer from urinary retention because the body is now focused with the pain felt during labor, diba? Ang katawan natin ay nakafocus siya sa pagpanganak. Hindi na yung mapansin-pansin na puno na pala yung urinary bladder or yung storage ng ating urine. So, ang tendency, there will be urinary retention, and if it happens, it will going to, what do you call this one? It will now prevent the delivery of your fetus, diba? Or your baby. That is why you have to empty first the doctor will going to empty first the urinary bladder by means of using a straight catheter, or not necessarily straight but catheterization in general. Okay, in general. And we're going to go to the topic further after we have discussed the necessary things here. So we have here your stasis. There's a word stasis, which is defined as slowing of the flow of urine and that can cause urinary tract infection. So slow ang flow ng urine. Diba? As we have remember in our human anatomy, your urine is produced by your kidney because your kidney is the one that manufacture your urine about 1 to 2 cc per minute. Okay, per minute po siya. So in 1 minute, you are going to have what we call this one. You're going to have in 1 minute, you're going to no, not 1 minute. So in 1 hour, you're going to have 60 cc or 60 ml of urine. Bakit? Sa sinabi ko, your kidney will going to produce 1 cc to 2 cc of urine per minute. Maging 2 cc lang po siya pag marami po tayong ininom na tubig, ha? Pero pag wala, so hindi po. Or maging 2 cc lang po siya, for example, you're drinking alcoholic beverages. Because those alcohols are having this side effects of suffering from diuresis or increased urine production, leading to increased urine elimination by your urinary bladder. So, let's go back to the word stasis. So, slowing of the flow of urine can cause urinary tract infection. Okay, it was stated plainly as that. So, bakit po nasuslow yung urine production, urine elimination? Sabi natin, napoproduce na urine si kidney. The problem was, yung tao palagi kumakain ng salty, di ba? Or sabihin na natin meaty, marami siyang salty nga, sabi natin. So, salty. Pag marami siyang kinakain na acid tapos less ng tubig, definitely, it will affect now the production of urine. The urine produced will be highly concentrated and if eliminated, of course, remember the flow of your fluid or water, and of course, remember also the flow with your concentrated, let's say concentrated elixirs, di ba? Or what we call this one? Yung plain water at saka yung ibang fluid form, such as for example, with sugar na po yung fluid or naging syrup na po siya. When you're going to pour it at same pace or the same manner, yung syrup tsaka yung ordinary tubig, they're going to flow. So of course, the syrup is having this slowness in flowing. Okay. Kasi nga, maraming asin yung ginakain natin. Asin po siya. So maraming asin, so yung urine production natin is highly salty, so masyadong concentrated siya. So if it is concentrated, definitely if it goes to the bladder, concentrated din. So pag ma-eliminate po siya from the kidney, from your bladder down to your urinary meatus, concentrated din. So pag concentrated po yung flow, so meaning slow po yung flow ng urine to the outside world. That is now your stasis. Okay. And if it is having the slowness of the flow, it could lead or trigger what we call this one ascending infection. The Geriatric coli coming from your anus or anal area. Because your anus is the end point of your large intestine. So basically, nandun sa sinabi natin basic infection control na discussion natin noon, yung Geriatric coli, which is responsible for the lubrication of your feces, and of course, it also helps in the manufacture of vitamin K inside of large intestine. At sinabi natin ang end point ng large intestine is your anal area. Basically, nandun po si E. coli doon. And remember, E. coli is the causative agent of your urinary tract infection. Kasi si E. coli, you've given him a chance to go up to the urethra. How? By having your urine so much concentration, now making its flow slowly. Okay, and that is called your stasis. So instead, remember the flushing action of urine removes the microorganism, but in your case, in the case of urinary tract infection, it does lead to what we call urinary tract infection. Then next is we have your clinical signs of retention. So discomfort with retention, we have here your discomfort in the pubic area. Of course, if we have urines being retained in our urinary bladder, these are your clinical signs. Discomfort in the pubic area. Medyo mabigat po siya. And then there will be bladder distension. If you're going to lie down flat in bed, you would notice that if you're pregnant, you don't only have your bulging abdomen due to your pregnancy, but also you have there your bulging pelvic area due to full bladder, or what we call retention or distended bladder. Inability to void or frequent voiding of small volumes, 25 to 50 ml. Pakonti-konti lang po na po yung urine na lumalabas normally. That is your urinary retention still. Decreased urine output, so as we have said, 1 cc to 2 cc per minute when you're going to have it in an hour. That is your 60 to 120 per hour. And you are going to multiply it into 24 hours. That would be your urinary output for 24 hours, diba? How about having 25 to 50 ml lang in 2 to 3 hours? That is definitely your sign of urinary retention. Kasi sabi natin, the minimal amount of urine produced, normal urine produced is 60 cc or 60 ml per hour. So decreased urine output, another thing, so hindi po siya maihi. So, diba, your number 3 and 4, it justify each other. And increased restlessness and need to void, diba? Sometimes if we have this urge to urinate, hindi po tayo mapakali, diba? Hindi tayo mapakali. Then causative factors of this problems, you have inability to get to the bathroom fast. Bakit nagka-retention? Either urinary retention or urinary incontinence. Okay, you try to guess what's the answer. Inability to get to the bathroom fast. It is urinary retention or urinary incontinence. So, diba, inability to get to the bathroom fast, that is your urinary incontinence. Inability to remove clothing fast, the same, that is urinary incontinence. Having to wait too long for the bedpan or urinal. O, nakaihi na po, hindi pa dumating yung bedpan or urinal natin, so definitely that is your urinary incontinence. Next, number 4 is urinary tract infection. So, is it urinary incontinence or urinary retention? Possibly, pwedeng dalawa. Pwedeng, as a result of the pregnancy, you suffered from urinary tract infection, and as a result of the stasis being mentioned a while ago, that is now your urinary tract infection still. Number 5, we have medications, or your diuretics, or the one that causes person to urinate or produce fluid for urination. So if you're going to drink those medicine, example Lasix, you will suffer from urinary is it urinary retention or urinary incontinence? Urinary incontinence. Another, immobility. Immobility leads to urinary retention. Number 7, emotional disorder or depression. So there is no urinary retention still. Number 8, confusion, forgetting to void. That is your urinary retention again. And lastly, number 9, that is your stool impaction. Hindi ka po makatae. So that is your urinary incontinence or retention. So that is also your urinary retention. Okay. So we're going to discuss that. We're going to continue our discussion with your urine assessment. So your urine normally is, we have there your organic solutes and your inorganic solutes. Normally your urine consists of 96% water and 4% solutes. When you say solutes, it's either organic or you have your inorganic. So when you say organic, that is your urea, ammonia, uric acid, and creatinine. This one is, saan siya? Organic. Your creatinine, this is responsible for the toxic waste. Ammonia, this is responsible for the smell, diba? Together with your urea. While your inorganic solids, you have sodium, merong asin, merong magnesium din ang ating urine. And meron din po siyang chloride, phosphorus, potassium, and your sulfate. Your urine is inspected for, ano natin i-inspect sa urine? Your urine should be clear. So that's why it is inspected for clarity. Your urine is also, the normal urine is straw amber in color. Hindi po siya masyadong yellow, hindi po siya red, straw amber or light yellow. So that's why it is inspected for color. And it is also inspected for odor because your urine should not be offensive ang odor. Ano po yung odor ng urine? We have faint, aromatic. Meron siyang odor that signify that it is urine. Because if it doesn't have the odor of urine, of course, pag ang odor niya parang kali, apple yung flavor, so iniinom na siya. Diba? Next, we have your blood. Wala pong blood sa urine, ha? And we have your pH, so it is normal pH is halfway. Your urine is halfway acidic and not basic, merely basic. So urine is actually acidic, ha? So there should be no presence of blood with in your urine. Remember that. Pag merong blood, so possibly if the person is menstruating, women pala, the lady or the girl is menstruating. Pag merong blood, possibly, merong na-irritate dun sa loob. So, kailangan walang blood. Okay. Another thing, wala din po siyang protein, wala din po siyang glucose or sugar. Kasi pag may protein na si urine, so it signifies now that you have a problem in your kidney. Or pwede natin sabihin may urinary tract infection ka at first. That possibly or that could develop to your kidney failure. Another thing, your presence of your sugar, walang sugar sa urine because presence of sugar in the urine indicates diabetes mellitus, di ba? Pwede lang siya, kaya nga pag pregnant yung women is tine-check yung blood sugar niya. Pag merong sugar, possibly there will be gestational diabetes. Pwede lang po si sugar pag buntis, pag positive 1. Pero pag positive 2, positive 3 na po, o yung present ng sugar, hindi na po yan pwede, ha? Next, we have your urine production as what I've said. 60 to 120 ml per hour, 720 to 1,440 per day. ml per day. Paano po siya in-arrive? So, the solution is 1 cc to 2 cc per minute po ang produce ng urine. How many minutes in an hour? 60. Times whole 24 hours will give it 720. Diba? Pag 120 times 24 is 1,440. Anyways, the highest at 2,000 ml per day with increased fluid intake. Pag maraming ka naman ininom na fluid intake, pwede pa siyang mag-exceed ng 1,440. Pero pag wala, hindi po siya mag-exceed ng ganon. 300 to 1,500 ml per day is the normal urine volume in children. While your 30 ml per hour, meaning that is your kidney malfunction. Pag 300 to 1,500 ml per day, balik-balik siya, no? This is normal urine production in children. So, we're going to delete this balik-balik na thing. Okay, deleted na po. Next, we have characteristics of urine. So, we have already discussed this one. Diba? Glucose, blood. Wala hindi ako gumagamit ng, ano ba yan? Hindi ako gumagamit ng kodigo. So, memoryado ko po siya. Okay. And the other, not offensive. Because if it is offensive, it signals bacteria or pus in the urine. And if it is sweet or fruity smell, it is associated with starvation o paggutom. Or it is having what we call diabetes mellitus. And sometimes po, the ingested foods such as your garlic, jackfruit, and even your medications, your antibiotics, and vitamins, yung yung smell po nila lumalabas sa ihi. Okay. Management report for assessment and blood assessment, ha? Kung may problema sa urine, report it immediately, especially the output. And the bladder training. So, how would you encourage bladder training? How would you do that? Pag hindi nakaihi yung tao, you have to ask the person to listen to running water. Diba? Or simple as call the cat. Diba? Habit training. So, kahit hindi na i-schedule the urination early in the morning before doing anything else right after waking up. Okay, there's your habit training. And before retiring to bed, okay, before ka matulog, dapat umihi ka. Paihin mo yung matanda para pag natulog yung matanda, sound sleep siya, sound sleep din po yung caregiver, diba? Next is pag bata naman, for example, I have 2 kids, but I never have a problem with this because every time we're about to sleep, I ask my children to urinate. Kahit hindi sila naiihi, dadalhin ko talaga sa CR, sabihin ko sa kanila na umihi sila. Diba? Kasi pag hindi sila umihi, magalit ang doctor. O, diba? That's your habit training. Pelvic muscle exercise, or we have this one, Usher Kegel's exercise wherein Diba? At sunod, nakarinig na ba kayo ng pelvic muscle exercise? That is daw your muscle control, diba? Sabi nila. Kasi pag parang ito gawin. So, you're going to imagine yourself bringing your anal area and your vagina up by counting one. Bring yourself inside the second floor, the third floor, fourth floor, fifth floor, and even the seventh floor with you inside the elevator. So that is your ihiyak ni mo ang tiyan pa at few seconds. So that's it. And then release it slowly. So this is your muscle control or Kegels exercise. And we have the catheter plus, of course, your skincare. Another, we have also your absorbent products that includes your diaper. I presume that you already have your return demo when it comes to application of diaper, ha? And another thing, when you say skincare, you have to clean the area that you have to do perineal care, especially after urinating or after defecating, ha? And another thing, you have to use water. So do not use just plainly wipes or something because our wipes have alcohol. It could destroy the skin integrity of the patient, particularly at the butt or the genital area. And then next we have your prostatic hypertrophy, defined as enlargement of your prostate gland. Okay, this is very much prevalent among males. Because of this, you have your benign hypertrophy. So hyper means increase. So benign hypertrophy, meaning medyo may inflammation po yung prostate gland. So this is what do you call this one? There will be an increase in the size of your prostate gland at age 50, at age over 50 DI. Assessment, hesitancy or dribbling, weak urinary stream. So dribbling, sakitan sila pag-ihi, so there will be frequency in urination. Urgency urination, di ba? Naiihi sila pero hindi sila makaihi. Hematuria, hema means blood, urea means urine. So there will be presence of urine, blood in the urine, And they will suffer from urinary retention. Okay, hopefully those are clear, mga pamba. Well, now, we will proceed with your measurement of your intake and output. Remember that your intake should always be equal with your output. Because if intake is less than output, what will happen? There will be urinary incontinence. Or, not necessarily incontinence, but fecal, possibly pwede rin fecal incontinence. But if your intake is more than output, there will be urinary, the opposite, retention. Okay, again, if intake is more than output, there will be what we call this one as urinary retention. Or possibly, kung sa GI naman tayo, that will be your fecal impaction or fecal retention. Pag urine naman, intake is less than output, meaning maraming output, konti lang si intake, that's your urinary incontinence, it could lead to dehydration. Okay. So, measured by ml or cc. So, ang imong unit of measurement sa intake and output ha is your ml or cc. This is the time when you're going to ask the client, ma'am, nakaihi na ka o nakaihi ka ba after 8 hours? Ilang beses ka umihi? Pag dalawa, sabihin mo, lagay mo sa chart na dalawa. Pag isa lang, isa. Pag zero, hindi siya nakaihi sa yung shift, so zero ang lagay mo. Okay. So, commonly used fluid container and their volumes. We have there your glass, 200 ml, glass juice, yung mataas, matangkad na mataas. The glass is 120 ml. Cup is 180. Soup bowl, 180. And then we have 100 bata, teapot, 240 ml, water pitcher, 1000 ml, ice cream dish, 120, paper cup, large, 200, small, 120. So, those are the compostable containers. Tingnan mo lang yung container pag sinabi ng ilang basong tubig lang yung ininom nyo po. Sabi niya, 2. Saan po yung baso? Eto po. Pag nakita mo yung baso, you're going to assess kung malaki ba siya o maliit. Excuse. Malaki ba siya o maliit? Pag malaki, sabihin mo 200. Pag maliit, sabihin mo namang 120. Diba? Tapos, ilang baso ka nakakainom ng, ilang baso po ng tubig na ininom niyo po? Sabi niya, 3. So, pag sinabing 200, so yung shift 8 hours, nakakonsume siya ng 600 ml. So, kailangan i-validate mo po siya kasi sabi natin, yung intake should be equal with the output. Sabi mo naman, nakaihi po ba kayo? Sabi naman niya, opo. Ilang beses ka umihi? Sabi niya, 2. So, naglagay mo dun na 2. Hindi mo i-measure yung urine pag hindi po siya nakacatheterize. Pag nakacatheterize po siya, nakacatheter siya, so ma-measure mo yung output. Pag hindi, pag able or ambulatory yung patient, tanong mo lang po kung ilang beses siya umihi. That's all. And then we have record the following. So, oral fluids, of course, lahat na pumasok ng tubig sa kanyang bibig. So, there's your oral fluids. Kasi may oral, di ba? Ice chips. Excuse. Ice chips, for example, from surgery po siya, hindi po siya pwede makainom ng tubig kasi mag-breakdown po yung GI niya. So, what will happen? Sabi niya, na po ako, so pwede naman sabihin natin, alagyan ng cotton ball, soak with water yung lip niya po. So, kasali po siya. Pag pwede naman siyang sabihin na, okay ba na pag malamig, so sa ice, ganun lagyan ng ice yung lips niya. So, dapat sabihin lang mag-swallow. So, ice chips. And then food. Excuse. Foods that tend to become liquid at room temperature. So, that's it. Pag meron ganun, record niya rin. Another tube feedings. So, yung tube feedings, may ilang ml ka na yung NGT, di ba? Ilang ml mo yung i-feed niyo po. Pag sinabi ng doctor, 150 ml, so 150 yung mo. Kung isang beses lang po siya may feed ng 150 ml, sa 8 hours routine niyo po, 150 lang ilagay mo. Pag 2 beses na siya nag-feed ng 150 ml, so 200 lang ilagay mo. As your intake. Parenteral fluids yung IVF or intravenous fluid or your dextro sa Bisaya, di ba? Or your injectables pag may let's say ang natira from your shift 800 yung natira na fluid na dextrose, tapos nung malapit ka na umuwi, naging na lang siya, naging 400 na lang, so ilan na consume niyo po? 400 din. So, i-record niyo po yun as your intake. Another thing, may in-inject sa kanya na 5 ml na medicine. So, i-record mo po din i-record mo rin po from 400, then mo 400 parenteral fluids, then lagyan mo ng 5 ml din yung parenteral medications. Diba? Another, catheter irrigation. Let's say, naka-catheter, naka-3-way catheter siya po. Pag naka-3-way catheter siya, di ba, may video ako na sinansa inyo na ganito, yung demo niya, 2. Pag yung tatlo po yung port, yung catheter, there's your 3-way catheter. Yung isang port is para saan yung isang port? Para connected sa urobag. And the other port is connected sa para naggumawa ng balloon doon sa inside the catheter. Kasi yung indwelling catheter po or your that is intended for catheter irrigation is have 3 ports pala. The long port. And the third port, what do you mean by port? Opening po. The third port is designed for the fluids that is used to irrigate the bladder. Bakit po? For example, the person is suffering from frequency, and then possibly there will be in your ultrasound there is the it was been the stones inside the urinary bladder was being detected, so kailangan natin i-irrigate po siya para kung saan natin dugmokon ba? Idugmok na to itong stone sa iyang urinary bladder by flushing it with more fluids. Diba? Or to soften now the hardened crystals or stones inside your urinary bladder. That is why you're going to irrigate the bladder. So, for example, 1,000 ml yung in-introduce natin sa urinary bladder, but basically, it will going to go down with a port connected to the urine bag. So, i-add mo din po yung catheter irrigation sa urinary intake. Ayun sa intake ng tao. Okay. Output. Examples. Urine, vomitus, and liquid feces. Sama na rin yung lahat. Tube drainage, in kaso pag may tube drainage siya, kasama po siya. So, tube drainage, for example, sa, ano ba yun? Including no yung catheter. Diba? There's your tube also drainage. Another, we have also your tube drainage, yung mga medyo maselan na may operation, may tube drainage nilalagay para ma-monitor po natin. Example, ano ba yun? May fluid po sa lungs natin, so tinatanggal po siya, that is also your tube drainage. And rapid deep respiratory breathing, so, excuse, diba, normal natin na respiration is 20 cycles per minute. Pag naging 50, tapos adult siya, walang ginagawa, nakatulog lang, so that is your rapid deep respiratory breathing. It also signifies loss of fluid, and then it is, you're going to give a weight to that as a output, fluid output. Diaphoresis or excessive sweating, so kailangan mo rin i-record po siya para i-record mo yung sweat ng tao. So, medyo marami nang gawin dito. I-pre-weigh mo yung damit niya na hindi po siya soaked with sweat, tapos i-weigh mo again na soak na siya with sweat. And then you convert it to fluids na dayon. Wow! Dugay na. Anyway, it is not your responsibility. Basta sinabi ko lang yun ang point ko consider natin sa fluid output. And then wound drainage also. So, intake and output are measured in total at the end of the shift. Intake and output should be equal. Again, intake less than output, that is your dehydration or incontinence. Intake more than output, that is your fluid retention. So we're going to have demonstration on offering the bedpan. I guess you're done with this. Offering the urine now, application of condom catheter, care of indwelling catheter, and of course the oral or measuring intake and output, types of urine specimen collection. So, yung oral natin sa MIO, remember that the thing that I have mentioned here, yung mga fluids, intake, record the following, yun po. So, sabihin ko sa inyo kung anong examples ng intake and examples ng output, anong mayayari pag intake more than output or intake less than output, ganon. And then, for example, I'm going to give you also a scenario, just for example, 250 ml yung intake niya, tapos yung output niya is 120 lang in 8 hours. Is it retention or incontinence? Something like that. Just to mess up with your brain. Okay. And we have now your types of urine specimen collection. But we're going to have that one. Types of urine specimen collection in your handouts, We have one is, your routine urine specimen collection. Next to that is your midstream urine specimen collection. And lastly, we have your 24-hour urine specimen collection. Okay. What is the difference between the two? Pag sinabi natin yung routine specimen collection, kung sabi natin gano'n, yun po yung gaya ng sinasabi ng nurse nyo or sa laboratory pag sinabing bigyan ka ng specimen bottle, sabihin na umihi ka dito po sa specimen bottle. Kaya hindi sinasabi na umihi ka agad umihi ka po, and then after that, at the middle of your urination, you insert the bottle under your urethra. And get the specimen. Diba? Yun ang sabi. So, another thing, get the specimen. Yun po yung routine. It is taken any time of the day. Okay. Any time of the day po yun. So, routine nga. Pag sinabi naman natin midstream urine specimen collection, sinabi naman natin midstream urine specimen collection, it is the most, it is a midstream or clean cut urine specimen collection. It is the most sterile type of collection. Bakit? Kailangan mo ng special kit as a specimen kit na ganon from the pharmacy or from the agency na or sa hospital laboratory. And then you have also, you're going to use also disposable gloves, bedpan or urinary commode, or you have plastic bag or sandwich bag, and also we have your paper bag or lunch bag. Okay, how are you going to do this? Pag midstream, kailangan mo mag-exercise. So, sinabi natin muscle control and your Kegels exercise. Diba? So, yun sabi natin, you're going to bring your vagina and your rectum up to the second floor, third floor, fourth floor, up to the seventh floor. And then, wherein you're going to hold your urine. Diba? So, sabi natin, amni ka ma'am. Hi siya, pak, ihi. And then, stop. Pag stop niya po, naka-ready na po yung yung specimen kit niyo po. You ask them to stop. So, that you're holding it for your vagina and your rectum up to the seventh floor, then automatically you insert now the specimen. Pag naka-insert na siya, sabihin niya, okay, umihi ka na po. So, umihi na po siya. Excuse. When the bottle or the specimen container is halfway empty, hindi ko sabihin 3/4 kasi baka ma-short ka po. Halfway empty, halfway full, you instruct now the patient na, ma'am, mag-stop ka po mag-urinate. So the patient now, we're going to bring herself or bring the vagina and the urinary meatus or the rectal area up. Hiyak na po siya up to the seventh floor. Then you're going to remove now your specimen from your urinary bladder, and after that, you tell again your patient to empty the bladder or hihina po ka, ma'am. So that is the time where the patient empties the bladder. Kailangan yung pag midstream or clean cut urine specimen collection, you're going to maintain the sterility of the urine. Excuse. Sterility of the urine. So pagkatapos niyan, you're going to wrap it with a plastic bag. There's your sandwich bag. So that's it. And then after that, you're going to remove your gloves, and then you have to place it again to the small paper bag or lunch bag size. So, and then you brought that to the laboratory. Diba? Yun po. No. So, dapat ganon. Okay. There's your midstream or clean catch. Next is our 24 hours urine specimen collection. You're going to collect the urine for the period of 24 hours. Diba? 24 hours. So, how would you do that? How would you do that? Paano mo gawin? Ang gawin po natin is, of course, for example, sinabi ng doctor, ma'am, you collect your urine 24 hours starting tomorrow at 8 a.m. Pag nag-start ka na 8 a.m., dapat at 8 a.m. mismo, empty mo yung bladder niyo po. So, kasali ba po yun sa collection niyo 24 hours? No, kasi ang production na urine ng gabi yun, di ba? Urine ng gabi yun. Ano ba? Mahirap ako magtagalog. Yung po urine ng pagtulog niyo po, yun. And then, after that, the next urination after 8 hours, when you have empty your bladder and then discard the urine, gilabay na mo siya, you will start now collecting it. Okay? Pag umiga ng 10 o'clock, so start collecting up to the period of your first urination the following day. So, 24. So, ato mo sa 8 hours, up to 8 hours, mo siyang i-collect. If you need preservatives, pwede. So, dapat nakuha ang container, ha? And, of course, we're going to place that in a Bucket with ice. Then, disposable. Bakit po then bucket with ice? Kasi, dapat ma-preserve si urine. And of course, you will use disposable gloves and of course, the funnel. So, dapat ma-preserve si urine. So, paano kung makalimutan ng patient? So, dapat lagyan mo yung door ng CR na save all urine na word. Okay. Save all urine ha. Sabihin mo sa client mo. Okay. So, that is for the period of 24 hours. Bakit kailangan ng 24 hours? Then, tingnan natin kung meron bang microorganisms na produce yung kidney nyo po. Okay. Next to that, we're going to stop here and then we're going to have a oral tomorrow and what do you call this one? Oral, and then we have also a return demonstration. Okay, that would be all. So, I don't know how to turn this off. So, we're going to continue your neurologic next time. It is your neurologic, not neurological. Okay.